We're really proud about our outcome measurement system because at Schoen Clinic we do like to measure things. We do like data. And as we are very focused and specialized, we do have very high case numbers in our medical fields. So for example, in hip and knee replacement, in total we perform more than 9,000 procedures every year, which is pretty unique. So therefore we have a huge amount of data because we not only measure things like patient satisfaction, but we also go into patient safety and of course patient reported outcomes. And we do measure that at the beginning of the treatment path as well as after discharge, and then we do the follow-up. So even after 6 months, 12 months or even 24 months after a spine procedure, we would follow up, send out forms, questionnaires, and then gather data in how far our treatment results are sustainable. There's actually no other competitor, at least in the German market, who has that level of outcome measurement. So we do, for example, when I'm talking about these quality outcome measurement KPIs, we do have a dedicated set of KPIs for 145 medical conditions. And this is pretty unique, and this has even been recognized by international players. So for example, Michael Porter from Harvard University. I mean, he is working very closely on value-based healthcare delivery, and he's actually teaching 2 case studies about our outcome measurement system, saying that there are very few organizations worldwide where he has seen such a level of professionalism when it comes to outcome measurement. And this is something which you will hardly find in the private hospital arena in the UK. So and I think in 2017 there will be some compulsory outcome measurement data to be provided by private hospitals. But this, I think, only covers 17 medical conditions. We are a couple of decades ahead of this development. So again, apart from the super specialization and the salaried model, the outcome measurement part will be unique to the UK market. So therefore, I think we can add a very interesting perspective to the current discussion which is emerging in the UK. So when our senior consultants do come together in those biannually expert groups, they do have a look onto the data and then decide, actually identify the best practices. And based on that, we would have a discussion on how to apply these best practices to other hospitals. So that's what we have, for example, in the area of mental health and eating disorders. That's something we did where we compared 5 centers when it came to the weight gain with anorexic patients, and they came up with insights on how to increase, how to improve the treatment process, and over time actually all the other centers who were first lagging behind significantly increased their outcomes. And that's actually how we handle this type of data. It's defined by the senior consultants or by the doctors, so they would sit together and say, so what will be a good KPI to measure? So therefore we ensure that there's a maximum buy-in into our quality management, and based on that we provide the data. And actually it's very transparent. So even as a nurse on a ward, you can log into the intranet and see how the outcome measurements are, how the values are actually evolving, and how individual centers are performing. So this is public information, and when it comes to public information, we actually we publish that externally in our yearly quality report, where we do show how we do perform against our targets. We are very successful actually in attracting patients, and for example private patients, where we have much higher ratios or amounts of private patients than our competitors in Germany. And I'm sure that the outcome measurement is an important reason for that. So London is the first step for us going outside Germany, but we do think and we do feel that there's still a lot of opportunities in the UK as well as in other European countries. So right now we are looking into major European metropolitan areas. Because we have seen that this concept of super specialization, outcome measurement, And as well, the salary consultant model is something which is not existing in many European markets. So therefore, London is the first step, but there will be more to come.